I wanted to just say that I've also enjoyed other speakers that we've had today. Some topics that I never would have thought of, or never would have had sort of any insight into. So just things like moving online, how that sort of changed the nature of how those weekly church groups met, and and just the impact of depopulation on temples, like just topics I'd never even have sort of considered. So yeah, thank you, and thanks again to the curators, the organisers, who have done a great job, I think, curating. Really enjoyed Andy's talk just now, and I think it does really lead in nicely to what I'm going to talk about, which is some more of, like, I guess, what's going on behind the scenes at the NHS website. So I think bear in mind what Andy was saying, especially from like the first half of his talk when I'm talking. So I'm just going to try and share this. So has that worked? Can you see a slide that says
good?
Yeah, brilliant, great. So hi everyone, I'm James. I'm a digital product manager at NHS Digital, which is a sort of central organisation in the NHS that looks after digital stuff, data, technology at a national level for the NHS. So throughout the pandemic, I worked on various COVID services, including things like book a coronavirus vaccination, get an isolation note, and the NHS website's COVID advice and guidance, which is what I'm going to talk about a bit today, specifically how we maintained this advice and guidance. So yeah, hopefully you'll get a bit of an insight into what went on behind the scenes. So from the start of the pandemic, NHS website was the destination for health information about coronavirus. So this is an image. It's one of the early sort of press conferences from the then Prime Minister. NHS UK/coronavirus all over the banners. That was the point at which everything sort of started going fairly nuts for us. COVID on NHS UK started off as a single page, actually started off in January 2020, where it was just called Wuhan Novel Coronavirus, but nobody really sort of remembers that time. By February 2020, it was still a single page, but it had got its coronavirus, COVID-19 name. It increased to about 5 pages by sort of end of March 2020. And by late 2021, we're talking about a whole hub of content. There's about 60 pages in all, covering everything from symptoms, testing, vaccinations, self-isolation, self-care and treatments, loads and loads of different topics, loads of different stuff that our users needed to know about. And all of this stuff was being updated on a really, really regular basis. Some pages, more so than others, obviously, but a lot of updates required to this stuff, and therefore a lot of work sort of going on to maintain it. So this hub of content wasn't just a collection of pages, it was also a gateway into all of these digital services. So things like booking a vaccination appointment, or finding a walk-in vaccination site, or getting a PCR test, or signing up for research. The content here, yes, it's health advice and guidance, but it's also actually sort of supporting people on user journeys to do something to hopefully improve or manage their health. And it was massive, very, very popular throughout the pandemic. There was anything between sort of 2 million and 38 million visits a week to these pages in blue in the center. So I'm talking today obviously about maintaining COVID information, and I'm talking about the activity that's required to keep it up to date, accurate and clinically safe. And I think it's worth just thinking about what are the reasons for updating information. And I think you can sort of maybe boil these down into three broad categories. So the first reason is that policy has changed. This could be clinical policy, public health policy, or sort of governmental policy. So an example of this is maybe when a new cohort becomes eligible to get vaccinations, we would need to communicate that information. A more extreme example was when it was sort of decided based on sort of new evidence, and it was decided pretty much overnight that under 40s should not get the AstraZeneca vaccine because of a risk of blood clotting. So this happened in sort of say sort of March-ish 2021, if you remember that. But there's a sort of very urgent need to sort of keep your content accurate and updated. The second reason is all about sort of emphasis, messaging, and campaigns and political priorities. So policy itself has not necessarily changed. There is not new clinical evidence about X, Y, or Z. It's that we need to have a different emphasis on things. So, for example, early in the pandemic, there were some real concerns that people weren't going to their GP or to A&E when they needed to because of fear of exposure to COVID. And we wanted to encourage them to actually go to their GP or go to A&E if they needed to. And we sort of made a load of changes to try and sort of get that message across. The third sort of group of reasons is user feedback. So this is when users of the website tell us, usually via surveys, that something isn't working as expected. So an example of this is when people who were eligible for treatments told us that it wasn't really very clear how they could order free COVID tests. So we made that journey easier for them to complete and to get those free COVID tests. I think it's worth saying that middle category, the one about emphasis, is absolutely the hardest to deal with because it's quite informal, it's very subjective, it's quite hard to pin down. We were approached, I think, countless times really by some Cabinet Office task force that we had never really heard of before, saying, oh, we want you to completely redesign this section of the website so that it aligns with the campaign that we're trying to run. And it was really difficult to know, frankly, if they were legit or if what they were doing was like joined up with something else that was happening, or, if their claim that, the Prime Minister wants this by Thursday, is that actually true? But, we would always, work around that. So hopefully, give an idea, we've got sort of policy and messaging changing throughout the pandemic. We know that our user research is uncovering issues all of the time. So how do we go about actually maintaining all of this really, really critical, important information? I think there are basically three ingredients, which I'm going to go through. So the first of these is processes, simple, repeatable processes. So for any other clinical guidance at any other time on the NHS website, we aim to review and update it on a 3-year cycle. As you can imagine, health advice about broken toes or chlamydia or worms in humans, which is the screenshot that we're looking at here, that advice doesn't change all that often. The advice here where it says don't let children play in areas where there's lots of dog or cat poo, that's pretty universal advice. That is not going to change. So 3 years is a really appropriate amount of time to review and to potentially update this sort of content. Slightly nerdy point here, but this 3-year period comes from something that is called the Information Standard. Information Standard was a standard for health information that described how you should sort of create, publish and maintain this information so that it was trusted and accurate and so on. The standard doesn't actually exist anymore. It's been retired, but we've kept many of the stuff that's where everything is changing all the time. Want to talk about what a publishing process actually looks like for us. So this is what an update to a page looks like. So we start off on the left with one of these sort of reasons for change. Obviously, we've got to understand that issue. You then get into this sort of feedback loop of designing stuff, testing it, fact checking it, making sure it's accurate, then sort of going back with feedback and so on. And then you get to the point where you can get policy sign off, you can get clinical sign off, and then actually publishing it. So there's quite a lot of steps involved in all this. And because of the volume of work that we were doing, we wanted to see, could we simplify this? But you can't just rip out this sort of governance to speed things up if you also want to maintain accurate, trusted content. If we were to publish health content without actually having some sort of clinical oversight, we would get ourselves into all sorts of bother. We did find some ways to cut corners. So example of this is because a lot of our changes, because we're doing such frequent changes, is often to like just one little bit of a page rather than to a whole page. So we could get our clinicians to review and approve just that one bit of the page, instead of making them review the whole page. So, there were little things we could do to speed things up. But, it's still quite a lot of effort going on sort of behind the scenes of every update. Also on processes, processes are usually there for a reason, sometimes a good reason, but it's not always obvious why they're there, or sort of why you have to do them when you're doing them. So it's really nice to, at some point, actually feel the later benefits of somebody following a process earlier on, and then to celebrate that, which we tried to do. So in June this year, my team started checking and removing COVID messages from about 450 non-COVID pages from across the UK. So these messages have been added over time to warn people things like it might take longer than normal to access contraception, or if you're an overseas visitor, you can get COVID tests and vaccinations for free. So the task of actually reviewing and removing the stuff was made a lot easier, because the wonderful content people who'd added these messages over the previous 2 years had just maintained a list of where they'd added them. So a really simple little thing, a little bit of extra effort for them each time they were doing it, but it made a huge difference to us when we actually came to reviewing this stuff. So, that's also, I guess, an insight into how these sort of big websites are managed. There is a lot of stuff recorded on, Confluence pages and spreadsheets and notebooks here and there. So obviously more important than processes, though, are people. So people and effort, I think, are the sort of the second ingredient into maintaining this stuff. This is a photo of me working in my shed. I think it's about 7 a.m. I'm wearing my pajamas and dressing gown. This was near the beginning of the pandemic. And we had no idea, I think, at this point, how all-consuming this was going to become. We didn't think it was going to last as long as it did. You can see, I mean, the table I'm working off is clearly a very temporary setup. I built myself a proper, little desk thing in the corner of the shed eventually, because I knew we were going to be there for the long term. But, I'm just working off some little foldable garden table. We didn't think it was going to last as long as it did. And initially, we just had this little group of content designers looking after it. They were all from other teams, and they just came together and did some COVID updates, and then went back to their teams and came together and did some COVID updates, and then went back to their teams. But really, the frequency and the urgency of these changes was it was like nothing we'd ever dealt with before. And people ended up working long hours. They ended up working evenings, weekends, and eventually we spun up a team, actually a dedicated team, to handle this never-ending sort of policy requests and changes. I think in hindsight, we should have done that sooner. We perhaps relied on the makeshift for a little bit too long. We should have recognised that, this wasn't going away. We perhaps all just hoped that it would go away soon, but it wasn't. And we probably should have been better about rotating people in and out of these emergency response groups to better protect them against burnout. These are lessons we learned sort of, or put into practice midway through, rather than sort of, knowing them from the outset. There's about 150 people who run the NHS website, and probably 100 of these were involved in our COVID response, and maybe 25 of those were really heavily involved. So spending, a big chunk of their time over the 2 years on it. But even with 150 people, you can't do everything. So, we were also pretty busy with other COVID services and COVID work, and maintaining everything else on the NHS website. And we had to be pragmatic. So there were periods of quiet, or relative quiet, where we could perhaps sort of pick up something that had been we knew was problematic, and we were out of firefighting mode. But those periods of quiet could be interrupted. So we had to, at those times, sort of pick up very short bits of work to fill those gaps. I think one larger problem that we had with our vaccinations page, where it was just the user journeys wasn't very clear, and there was some slightly clunky stuff, and it was bigger than it should have been, just because it had grown organically. It took us months to complete this work because we never really got a decent stretch of time to focus on it. And every time we came back to it after a pause, the world had moved on, and we had to sort of, go back several steps with our research and testing. So the third of the ingredients is purpose and standards. And I think it might be counterintuitive to think that having standards, i.e. a minimum level of quality that you have to meet, is going to make it easier to maintain information. But standards, along with a clear sense of purpose, I think help you to focus on what's most important and to reduce wasted time by steering you in the right direction to begin with. So when I talk about content standards on NHS UK, I'm talking about content that is up to date, accurate, and clinically safe. So it's actual health advice, health guidance based on evidence that won't cause harm. It's also clear and accessible. So we aim for a reading age of 9 to 11. We avoid jargon where we can. We keep it concise. And it's useful and it's action focused. So we want to give people clear guidance on what the next steps are: get a vaccination, self-isolate, etc. There's a link in there to the NHS service manual, which covers all of the standards for not just health content, but sort of publishing NHS services on the web. Standards often make things quicker for us and better for our users. So this is a screenshot from the Gov UK and NHS UK shared coronavirus style guide. It's no longer available. It's been sort of taken down and absorbed into separate style guides. But while it was there, it meant that we didn't have to test this or that word every single time. It meant we didn't have to debate which word to use. And on top of that, the words that we used across these two really, really critical websites were pretty consistent. Likewise, the standards in the NHS service manual sort of gave us a mandate to create clear and concise content. So we'd often get, we'd be working with public health and policy experts, very well-meaning, who would argue that we had to include some really unnecessary details or use very specific technical language that our users wouldn't understand. And having standards allowed us to push back on these requests and focus on what our users really needed. And then finally, having a clear purpose also helped us to maintain this information. So we were really clear about what was in scope for the NHS website and what wasn't. So health information for the public in England was in, information for clinicians, information for people in Wales or Scotland or Northern Ireland was out. It meant we could push back on requests that were out of scope, no matter how sort of well-intentioned or maybe how important or valuable those things were. Being clear in this sense about our purpose and our scope meant that we could focus on doing a smaller number of things well, instead of a larger number of things less well. So yeah, that's it. To recap, these are the three ingredients that I think were necessary for maintaining COVID-19 information. So talking about processes, we're talking about people and effort, and we're talking about purpose and standards. Thank you very much.